When we talk about hospice care, one of the most important parts of the work, maybe the most important, is communication. Not just talking to patients and families, but talking with them in a way that's meaningful and easy to understand. This message is for my hospice professionals out there, but families who are watching, you're absolutely part of the discussion too. Hi, my name is Les, and I'm a hospice nurse and an end of life educator. And today I'd like to share some tips for clear communication. First, say the quiet part out loud. Families don't know what they don't know. They've often never been here before. If you're noticing changes, if the care plan is shifting, or if symptoms are telling you something, say it clearly. Don't hint, don't dance around it. Clear communication doesn't cause fear, it dispels it. Next, use plain human language. Families shouldn't have to decode medical terminology at one of the hardest times of their lives. Instead of declining respiratory status, say their breathing is changing because their body is getting tired. Instead of terminal agitation, say sometimes people get restless as they get closer to the end, and here's what we can do to help. Plain language builds trust, and trust is everything. Next, check for understanding and don't assume. Ask things like, does this make sense so far? What questions do you still have? Or would you like me to explain it a different way? And for my families watching, it's always okay to say, I'm not sure I understood that. Could you explain it again? You're not bothering us. You're helping us take better care of your person. Next, invite their voice into the room. Ask things like, what are you most worried about right now? What matters most to you and your loved one today? Or what do you feel ready to talk about? Families don't just need information, they need partnership. And finally, end every visit with a roadmap. Before you leave, take a few seconds to recap. Here's what's happening, here's what we're watching for, and here's what to do if you need us. That moment of clarity can take a family from overwhelmed to confident. Clear, honest communication isn't just a skill, it's an act of care. And when we get this part right, everything else goes smoother. Symptoms, emotions, expectations, and trust. Whether you're a hospice professional or a family member, I'd love to hear your experience with communication in hospice. Feel free to share it in the comments. As always, thanks for stopping by, and I'll see you soon.